welcome to TMC Fertility.
Hi, I'm Wani. I have an appointment with Dr. Navdeep today.
Hi, Miss Wani. Dr. Navdeep is ready to see you now. Please follow me.
Alright. Hi, Doctor.
Hi, Wani.
I have a challenge for you today.
Sure.
Are you there to accept the challenge?
Yes, definitely.
Alright.
Come, bring it on.
So, here is a board that
Okay.
contains the top 5 most searched questions in Google.
Fine.
So the challenge is that you need to peel off the questions and answer all of them. But you can actually get your colleagues to assist you.
Sure. Okay. Let's start. As for the first question, okay. What can I expect on my first consultation with a fertility specialist? Well, at the first time when you see a doctor, generally what we do is we'll ask you lots of questions. Okay. About your previous history, any medical problems, previous surgery, or any fertility related treatment that you have undergone before. Okay? Once we have asked you all the questions, then we will do a certain examination on you to determine your problem. So one important modality that we gynecologists use will be the ultrasound scan machine. Okay? By doing an ultrasound scan, we can determine whether you have any cysts, any swellings in your womb, where we can correct any problems that you have. Okay? So in short, by asking you all the questions and examining you, we will know the exact treatment option to be given to you.
Oh, I didn't know there's so many things that we need to know in our
Yes.
first consultation. So thank you so much for the information.
No
How
problem.
about moving on to the second question?
Yes,
please?
come. Let's go back to my table.
Yeah.
Okay? And let's ask Google.
Yes.
Okay. So the second question would be, it'd be interesting. What should I bring to my first fertility appointment? Let me see who can answer this question. Let me go and ask my nurse to answer this question for you. Hello. So this is my nurse, Miss Azrina. Okay. So she will answer the question for you. So the question for you is, what should I bring to my first fertility appointment?
Okay, during your first visit to our fertility center, you will need to bring IC or else your passport for the registration purpose. And then if you have done with any blood test recently, you can bring along together. Or else you have any medical issues, and then you can bring your medication over to see doctor together with you.
Excellent. Thank you very much, Azrina. We'll go on to the next question. See what it is. Okay. So the next question is, what is the role of an embryologist? Okay. So I guess this question should be answered by my embryologist, Miss Lu Jai. Okay. Come, let's go and look for her now. Okay. She most likely will be in the lab. Alright, so basically an embryologist is a person, our little angels who are around here, who will help create your babies, okay, and you'll nurture your babies in the lab and also babysit your babies if you were to freeze them. Okay, come on in. Jai! Alright, hi Jai.
Hi.
How are you doing? Must have been a busy day today.
Yeah.
Okay, so let me introduce you to my embryologist, Miss Lo Jai. Okay, so there's a question for you today. The
Okay.
question is, what is the role of an embryologist?
Well, an embryologist is basically a person who studies sperms, eggs, and embryos. We are responsible for the in vitro fertilization process inside the lab, from the retrieval of eggs to the fertilization, embryo transfer, and embryo freezing, as well as maintenance and monitoring of the lab condition and equipments.
Yes, so you can see, as I told you, they are very important personnel in our clinic. Thank you very much, Jai. You
Sure,
can continue
no problem.
taking care of all the little babies we have inside the lab. As for the next part of the Google questions, let's peel off the other part. Excellent. So the next question is, what causes infertility? Let me see. I think the best person to answer this question will be my colleague, Dr. Chong. Come, let me introduce you to him. So, Dr. Chong is our fertility specialist over here, and he's been in our team for quite a long time. So, he'll be the best person to answer this question for you today. So, this is Dr. Chong's office, so let's look for him today. Chong? Oh, hi.
Yes.
Hi, Chong. How are you doing?
Hi, all right.
I got some Google questions for you. So
Okay.
you don't mind answering it for me?
Yeah, sure, let's go.
Okay, come on in. Alright, Chong.
Yes.
there's a question for you.
Yep.
What causes infertility?
Okay, I'm glad you asked. So the cause of infertility can be divided into male and female. So the male side, the main thing is poor sperm quality, which can be found in 50% of couples that we see. Performance issues such as erectile dysfunction is also quite common, and occasionally we have men who have zero sperms in their seminal fluid. This is called azoospermia. On the female side, abnormal growth such as uterine polyps, fibroids and ovarian cysts are also very common. Other causes include irregular cycles, which can be found in women with PCOS, and maybe blocked fallopian tubes as well. But most importantly is reduced egg quality that happens as women age. This is the biological clock.
Yep, that's fantastic. So you summarize the whole thing very well, clear for our audiences. Why don't you help me to peel off the next question?
Alright.
Oops.
What are the options to help treat infertility?
That's an interesting question, John. What do you think? I think let's ask Dr. Navdeep to answer that question. Thank you very much, John.
Hey, I thought you were Dr. Navdeep.
Yes, I am. So come, let's go back to my office.
Sure.
The options to help treat infertility all depends on the problem the patient has. So as I mentioned earlier, we'll assess the patient in all the history, the examination, and then we'll decide what are best options for the patients. The options can be just trying naturally, for example, telling the couple when's the best time to have intercourse, for example, at their fertile period, or you can go on to the next level where we give them some medications to grow their eggs and tell them when's the best time. And if they still unable to conceive, then we go on to the next step, is known as the intrauterine insemination. We take the husband's sperms, concentrate it, inject into the womb directly. However, if that still fails, then we have the test tube baby option, where it's known as the in vitro fertilization, where we give them 10 days of injections, get the eggs out, and mix the eggs and the sperms in the lab. Then we transfer the babies into the womb. Okay? In couples who still fail in spite of doing the IVF, there are other options where we can try to tweak their IVF cycles. For example, there are things like the pre-implantation genetic testing, is where we check these embryos for any genetic abnormality and we can identify the best embryo for transfer. There are other things like the endometrium receptivity analysis, where we can check the womb lining to ensure that we transfer the embryo at the right time. So basically, as you can see, we have a wide range of treatment options available here. It all depends on what the patient's problems are.
Great! Thank you so much, Dr. Navdeep, for answering all the questions.
Thank you very much for the challenge, and I really hope that we clarified all the doubts you had and answered all your questions. And if you are keen to see us or you're keen to ask more questions, then please contact us via the care line or drop us an email. We'll be happy to assist you.